Hi everyone, it's a pleasure to welcome you all to the launch of the Birmingham Men's Health Report. As a city, Birmingham has always prided itself on its diversity, resilience and commitment to improving the lives of everyone who calls it home. But when we look closely at men's health, we see stark and sobering realities that we just cannot afford to ignore. This report shines a light on deep-rooted inequalities that shape the health of men across Birmingham, which are inequalities driven not only by biology, but by the social and economic conditions in which people live. In some of our most deprived wards, men are living significantly shorter lives than those in more affluent areas. And we also know that men from Black, Asian and other ethnic minority communities were disproportionately affected by COVID-19, and that these disparities are symptoms of a much wider and more persistent problem. Men's mental health, cardiovascular disease and substance misuse stand out as particular areas of concern, and we see too many men suffering in silence and too many lives lost to preventable causes and too many families left picking up the pieces. The culture of silence around men's mental health, the expectation to stay strong, to not ask for help, to just get on with it, is taking a devastating toll. These pressures, combined with unemployment, poverty and isolation, lead to worse physical and emotional outcomes. We must do better. Healthy ageing should not be a privilege, it should be a right for every man in every neighbourhood in this city. And that means tackling stigma head on. It means investing in prevention, ensuring that services are inclusive and accessible, and that men are supported to engage earlier and more confidently with their health. And this report is not simply an analysis, it's a roadmap for change, and it sets out practical system-wide recommendations to improve men's health outcomes across Birmingham and to reduce the gap between those who thrive and those who struggle. And importantly, this work also comes at a critical moment nationally, with the Department of Health and Social Care seeking evidence to inform a national men's health strategy. Birmingham is taking a forward-thinking approach and leading from the front and showing what is possible when we bring together local insight, partnership and compassion. So today's launch is a statement of intent, a commitment that as a city we will not stand by while preventable inequalities persist. And this report is a sister paper to the Birmingham Women's Health Needs Report published by Public Health in 2024 as part of Public Health Gender Health Inequalities Review, which is also available to read online. Together, these reports provide a more complete picture of how gender shapes health across our city and how we can act to reduce inequalities for everybody. Let us move forward together with compassion, with courage and a shared commitment to building a fairer, healthier Birmingham for everybody. Thank you, and I really hope that you enjoy this session.